today with our panelists about mental health and how to integrate that into the aviation culture. And before I get started, I want to share an opportunity with everyone in the room who is in the industry as either a pilot, ATC, anything. And we're asking for people who have experienced mental health struggles to share their story. One of the goals of the symposium is to break down some of these barriers to staying healthy and seeking help when you need it. I think most people here would agree that aviation culture, at least regarding mental health, is very much one of secrecy, silence, and fear, for valid reasons and a long history of concerns, right? But the silence and the current system that we're dealing with have been feeding off of each other and need a change, and that's why we're all here. And one of the best ways to start change is by sharing stories. So to help with this, UND is trying to collect stories from aviation folks who are willing to make their experiences with mental health or share those experiences with others in the community to reduce that fear, reduce that stigma, and hopefully make some changes. We recognize there's a problem, the industry recognizes there's a problem, but do we really understand it? And to understand something, we need to talk about something. So that is your opportunity to share your story. If you follow that QR code up there, you'll input your contact information, short 1 to 2 sentences of, your story if that's what you want to do. And then we'll reach out at some point in the next few weeks to a month and sort of touch base with you and see if you're willing to share your story. You're welcome to change your mind, but we would appreciate all the feedback. So to get started, I'll let the panelists introduce themselves.
Hi, I'm Dr. Jessica Auslander. I am a clinical mental health counselor in private practice in the Charlotte, North Carolina area. I've been working in aviation mental health since 2012, both in private practice and as a consultant to critical incident and peer support programs for both Part 121 and 135 and some collegiate groups. So I kind of joke I'm a geek for hire, but I've kind of watched this industry grow and change as if the past 12 years.
Hi, I'm Aric Raus. I am an active duty Army officer. Been serving either in aviation of some type in the civilian world or in military aviation for 30 years. After about 5 years ago, decided to get into the aviation mental health and really focus in on that, and did research recently into barriers to mental health seeking and the acceptability of self-help options amongst current and former U.S. Army aviation personnel, UAS, ATC, and air crews. Just for clarification, though, I am here on my own, and none of the comments that I make should be considered the official view of the U.S. government, the U.S. Army, or the Department of Defense.
Thank you. Hi, everybody. My name is Michelle Westcott. I am a licensed professional counselor here in the state of Michigan. I work with those in the aviation population providing counseling services. I'm also part of an aviation family, and I volunteer for PMHC, which is the Pilot Mental Health Campaign.
Awesome. So we have the Slido link up there if you guys are wanting to ask questions but don't want to raise your hand. So we have Lila back there reading those and raising her hand when one pops up. But since we don't have anyone to start with, I wanted to sort of revisit this individual's question about
You're famous
I'm
now.
calling you out. Just kidding. But what are some ways that people can get help without taking themselves off the flight line? And at what point is seeking help disclosable? Who would like to start with that?
You want to just pass it down the line?
Yeah, let's go down the line.
Yeah.
So, that's one of the most popular questions I get, both in private practice and working with peer support. And it's recognizing and accepting within ourselves that mental health is health. It's physical health, it's medical health. It's normal for a pilot to maybe not fly that day because they think they have an ear infection or sinus infection coming on, right? Because that's painful. It's the same thing with mental health. There's a very large difference between having kind of a down day and just needing a break and going full on with, okay, I have a diagnosis, I need medication. There really is a huge spectrum. That's why we have peer support. I see peer support as the kind of one end of a larger mental health continuum, but we tend to think of mental health, I think, very black and white. And that's not really the case. People are kind of inherently messy. So, with the new guidelines, I get questions all the time. Well, now it's reportable. Now it's reportable. Yes, it's reportable, but it doesn't mean it's deferrable. And the AMEs have been giving a lot more information about what's actually deferrable when before they didn't have much to go from. So they were kind of deferring as a default. But now, if you see a counselor a couple times because maybe, it's a really stressful semester or you're in college and something happened at home or there's a grief or loss situation, and you see a counselor, it doesn't have to be for months. It can be brief, solution focused. We have lots of tricks up our sleeve. You can see a counselor a couple times, and if you disclose that to your AME, these are not things that are going to be safety concerns in flight. So it's kind of accepting that it really is more of a continuum than we typically talk about.
Yes, so for getting help, it's when it gets to that point of needing the additional help, when self-help is not going to be useful. But one of those aspects is knowledge of what self-help options are out there that are self-administered and because of that are not required to be reportable, such as mindfulness training or cognitive behavioral therapy or even transcendental meditation. And that's part of what the research that I worked on was looking at how acceptable those different techniques were, both in the current conditions and in a condition where the FAA, and in my case, the DoD, were to say, hey, these are useful tools for you to use, and in addition to that, clarifying that you don't have to disclose if you're using these self-help products on their own. And we saw a very large increase in the acceptability, the perceived acceptability of those tools if there were communication that would say, this is something that is useful for you and you don't have to let us know because it's just mental well-being. You're just trying to help your own mental wellness. And that's the key, is getting the self-help, getting the mental wellness before it becomes something that is truly a mental health condition that requires higher level assistance from an outside individual, a mental health practitioner. And so that would be my main point.
Thanks. Yeah, and going off what was just said, kind of that preventative care, seeking those services and kind of learning the skills are going to be helpful to those that are in aviation for the rest of your career, right? You're going to face stressful experiences. If you use these coping skills that you learn in therapy, and especially somebody that works with the aviation population, right, like myself and Dr. Auslander here, we know the ins and outs of the industry, right? If you come to us and say, hey, my AME needs something or whatever the case is, we know exactly what they need and where to provide it compared to other providers that I'm sure just are as good as well, but in experiences where they might need a piece of paper or something clarified, we are trained in that, right? We know what to do in those type of situations because there's nothing more stressful than getting that letter, right, that you're deferred, and now you have, all of these things that you have to collect, trying to wait on your providers to get that information, right? So again, that preventative care and then having somebody that specializes in whatever services that you're trying to seek.
Thank you, guys. And I'm going to put in my 2 cents too. And sort of a shout out to UND for having this position embedded in the aviation buildings. Part of my role is not just therapy, but having consultations with students about what they are going through, asking hypotheticals for if their friend is having symptoms, how would that go, right? It's so confusing, and it is a lot of just gray area that is really hard to navigate. Layla has a question.
Plato has a question. What is/are the most common misconceptions about mental health conditions and FAA regulations do you see in your practice? How do you see these misconceptions being reduced in the future?
See, I think that could kind of be a theme for the day.
Turn it on. There you go.
There we go. It's having an issue. There we go. I think that really could be the theme for the day, right? A lot of misconceptions that I hear from pilots. It does vary, kind of generation to generation, right? But a lot of the misconceptions I hear is that if I catch a feeling, I'm grounded. No, it's not that black and white. It's a lot of if this, if this, if this, and it always comes to the worst case scenario. And recognizing there are a lot of best case scenarios. Since these regulations have been changed, I have probably close to a dozen stories now, success stories of people, coming out of the queue that were previously deferred, people sailing through their visits, disclosing therapy without it being a problem. I have a college student who's an ATC freshman this year at a university who's not represented here today. And watching his experience, there are a lot of positives, but we tend to assume it's always going to be negative, right? It's that kind of thing, what if it goes wrong? But what if it goes right? Right? So the most common misconception, to be very general, is that it's going to be a worst case scenario.
I'm going to defer for a minute.
Again, what Dr. Auslander was saying, definitely if I have some sort of mental health condition, or even if I seek help, that I will never fly again, right? That it will take too much time to get my license back, I will lose income and things like that. As far as my pilots that I treat, a lot of the symptoms are probably very similar to what you might be experiencing right now as a student pilot. Anxious symptoms. I have a big test coming up. Hey, I just moved away and I'm kind of states away from my family, adjusting just to college life. Very rigorous and demanding program, right? For those of you that are involved in the program here or elsewhere, it's not the same as your friends that maybe are going for like a business degree or something like that. Time management, things like that. So the people that I see, at least on this level, have very similar stories when it comes to that. But again, they don't seek help because there's the stigma around it. And then those feelings build and build and build until we're what was referred to like the orange or red zone. So preventative care, I feel, is most important to learn tools how to kind of alleviate those symptoms.
Yes, I would go back to the idea that there is a myth that even self-help type of options can be grounding. And the idea that if I go to a course that teaches me about mindfulness training or transcendental meditation, it teaches me the aspects of that, that in and of itself is something that is going to hinder my ability to continue forward. And so basic mental wellness, taking that to the worst extreme and saying that that is actually treatment, and because of that I have to disclose it, and because of that now we get into this whole cycle of it being the worst case scenario. And so understanding those aspects of, hey, what is the difference between treatment and just general mental wellness techniques and things that we learn over the years to be able to handle the stress that happens with life versus something that is actually a diagnosable condition, or a condition that requires true therapy in order to be able to keep yourself in the green, as it would be.
Yeah, real quick. The technical term for it, we call it psychoeducation, right? Just learning. And most of y'all didn't have great health classes in high school, right? I know I've got high school students. Yeah, you learn this stuff to scare you away. Like you don't get education about how your brain actually works. A lot of what I do with pilots across if it's a collegiate, all the way up to my looking at retirement pilots, a lot of what I do is just teach them how their brain is working and why they're experiencing what they're experiencing from like a neurobiological level. And half the times it's the congratulations, you're normal conversation. Your brain is doing what it's supposed to do. It may not be comfortable, but it's doing what it's supposed to do. A resource that many people don't know is out there, especially post pandemic crisis, is if you go to your health insurance, or if you're still on your parents' health insurance, that insurance company probably has online resources for free, like psychoeducation, mindfulness, information about general wellness and nutrition, because that's prevention. Your insurance companies are very much motivated to keep their costs down. So people overlook there's a lot of free resources. Nicotine cessation, that kind of therapy is completely free now for most companies. So if you have access to healthcare benefits, either your own through the school or through your parents, take a look what might already be out there at your fingertips that's completely free. And again, not reportable because it's psychoeducation.
Thank you. And I think something that I've seen that's interesting and anecdotal, I don't know the research for this, if there is any, but I've noticed that in the college population, there's a big disconnect between aviation folks and the general, just college folks. in how mental health is talked about. For the rest of the college, people are very open about mental health struggles, challenges. They have support just by talking about it. Whereas a lot of the people in the aviation community in college, there's that expectation that I should be talking about this because my peers are, and I need to not talk about this because what happens if I do? So there's this huge fear there, and I think that's something that people outside of college aren't really recognizing at this point, because there has been a shift. And I think Dr. Bierke's research looking at barriers to healthcare seeking in college show that there isn't that stigma anymore about having a mental health disorder. It's the fear that comes with what happens after I disclose it. So that's, I think, the biggest thing that I've seen. So speaking of resources, do you guys have any apps or books or anything like that that you think are helpful for people to check out, I guess? One or two. Or none.
So it's tricky because I don't want to endorse a specific product, but I mentioned like looking at resources that might already be under your nose. Instead of suggesting a specific resource, I would encourage you to be active consumers and make sure whatever resource that you are engaging with and information you are getting is from reliable, updated sources. Right? So if you get something through social media, take a second and actually verify it. I love Google Scholar, right? Because even if I put a couple keywords in, even if I don't understand exactly what I'm researching, if there's nothing hitting that word, okay, maybe that's not actually in the professional jargon. So instead of recommending a specific, I'll dodge it, but
Please
with
do.
information.
Please do.
Make sure that whatever information you are getting, you are actually kind of verifying. One of the biggest challenges I have as an aviation mental health professional is with the stigma and the myths. Someone telling me, well, my dad's friend's captain told him on a flight in 1985, right? This. And it's that kind of word of mouth. We're going to inherently trust sources that are close to us, right? So if Sky tells me something, I'm probably going to believe it, right? Because we're friends, right? I may not check that information. But when you kind of get the telephone game going and kind of the gossip game going, that information can get twisted. And I've had a lot of my clients over the years bring me things they find on social media. And I'm at my laptop pulling up the actual science that usually counters it. So just be very mindful about what you're consuming.
Yes, and that's especially true with the changes that we've been seeing in the FAA process over just the last 2 years. Is what you heard and what was the truth a couple of years ago may not be the truth and probably isn't the truth.
Like 6 months ago.
Yeah, 6 months ago isn't the truth today. And so we look at these different aspects that are out there and making sure. Now, as I've mentioned, the idea of mindfulness training or transcendental meditation or non-directed, so not with a mental health provider, cognitive behavioral therapy types of actions that are out there, use what works for you. Mm-hmm. Try out a couple of the different things. If you try transcendental meditation and you decide that chanting a mantra just doesn't feel right, well then try mindfulness training and see how that works with trying to just be there present in the environment that you're in. And if that doesn't work for you, then start looking at how you can change those negative thoughts through cognitive behavioral treatment actions, techniques, thank you, techniques that are out there that can help you to just make yourself a better individual, remembering that we're aviation people, but we're also actually human beings. It's one of the hard things for us type A personalities to go ahead and accept, is that we actually are real life humans too, in addition to being aviators. And so we need these different techniques, and the more you arm yourself with things that can help you to get yourself to be in that mentally accurate and appropriate position, the easier it is to handle situations when it comes later on, when there are unexpected situations that occur, to be able to take that situation and ensure that it doesn't create a flight or flight reaction that goes to an extreme.
One of the resources, I think, especially at this level, at the collegiate level, is your advisors, right? Utilizing your advisors, not your just career advisors or, class advisors, but getting those resources. I'm sure they all have plenty that would be able to help you out. Just like Dr. Auslander, I don't want to promote any specific. But what I like to say to my clients is, and anyone for that matter, is always have a toolbox, right? So I'm experiencing anxious symptoms today, right? What can I do right now? Maybe it's right now in this room, right? I can't utilize some of my tools, but I can do some deep breathing techniques, right? I can step outside, maybe do a quick meditation. But you want to have a toolbox that you can utilize throughout your career that isn't just one thing, right? But definitely at this level, I would utilize what the resources that you have through your university, right? They go unused, and they can provide you some information too.
Go for it. Go for it.
Now?
There we go.
Okay. So I just wanted to say on the topic of resources, clearinghouses, there is like the nccih.nih.gov is a clearinghouse for wellness resources. So it will tell you if a certain practice or tool or wellness resource that you may have come across on social media, it'll tell you if it's evidence-based and to what level. Clearinghouses do that. They're great ways to make sure that you're not just taking advice that wouldn't be actually for your benefit. And then there's also a bunch of like Michigan, I know not all of us are from Michigan, but each state also has community resources for wellness that will actually like on those websites, and I can compile a list if it's helpful, but that will provide webinars or like self-guided practices that are like categorized by what you might be going through.
Yes. We've got another Slido question. Is that okay?
Yeah.
Okay. What is the best way for a student to find a capable and qualified mental health therapist who may know the aviation rules?
That was awesome.
I turned it on.
Okay, thank you. So, one of the things I have done over the last few years is that I have developed a course for mental health professionals in aviation mental health. It's going into its 4th year. It is approved by the NBCC, which is the National Counseling Board, for continuing education hours for therapists. So, from that course, then people can fill out this Google form. I have a very basic, it's intentionally basic. I designed it for lousy hotel Wi-Fi. Like my IT person, we intentionally test it every time we travel. So it's pilot friendly, meaning poor Wi-Fi. Tell me I'm wrong. So I've been married to a pilot for 21 years, so I knew a few things. It's amhdirectory.com, Alpha Mike Hotel, Aviation Mental Health, amhdirectory.com. It is very basic. If there's a hyperlink on a state, that means that there is a therapist in that state that is licensed or has telehealth privileges in that state that has taken my course or has other mental health experience. So there are some of my fellow ALPA consultants that are on there, some people that I know have been working in the field longer than I. They don't need to take my class. They're on there as well. It is not a HIMSS list. It is not HIMSS psychologist, HIMSS AME. It's just people that have either gone through me and been vetted or have taken my course to get on this list. And that course came, or the list came out of pre-pandemic when I was working with the HAWK program with NetJets and NJASAP, trying to compile this list. And so those contacts, like Kim Talor started emailing contacts and other airlines for peer support programs, and we were getting like Word documents and spreadsheets, and it was a list of names of people that people had gone to successfully. At a conference, someone hands me like a cocktail napkin with names. It was great. So it kind of became my pandemic project, was to compile all of this. And in reaching out, I actually learned that many of the providers, it was no longer a current or valid list. So I just started over. I just said, okay, forget it. I'm just going to fix this. And that's when the course came out. And that list has been developed. Now, that being said, I always have 2 kind of disclaimers to it. One, that is not the only list of providers ever who will be effective for you. You want to find a counselor that's the best fit for you. Let us figure out the paperwork later. So I always offer free consults. If I have a pilot who calls me, says, hey, I'm working with a therapist, it's time to do the paperwork, I don't think they know what to do, give them my number, my email address. I will provide that consultation completely pro bono and educate that provider on what they need to do and how to make it work for for the FAA side of things. And then the other caveat is, you want to find, again, that provider that's the best fit for you. So that's not going to be just that person on the list that knows aviation. Aviation, I know this is shocking, it's only a part of your identities, right? It's only a part of who you are. I know there's some rumbling. I love that. I love rocking this boat. You're a person first, you're a human being first, right? Aviation's a big part of it, but it's not your total identity. So going to someone who focuses in aviation mental health, I may not be the best fit for you. Maybe your concern is something with grief and bereavement, and I don't have a lot of training in that. I'm going to help you find that person who does. So yes, we want, in a perfect world, we would have way more aviation savvy mental health professionals. I'd like to see my course turn into a certification one day. So there's a little bit more kind of, some legs under it. But that doesn't mean that is your only option for mental health care. Want to add?
Yeah, from a pilot's perspective, it's talking with other pilots and asking around. Hey, do you know anybody who I can talk to who will help me figure out if this is something that is going to be an issue or not? Who can help me get the help I need without it being an issue, or try to do their best to work that. And so I know that in my area of Kansas City, we have a couple of pilot networks where we freely share, hey, I've gone through some issues, I've talked with this person, and they helped me find a path forward. Be it a path that required me to go through the FAA's process, or a path that prevented me from having to go that route because of the level of help that I needed didn't reach to the level of being an issue with the FAA. And so having that sense of community, but that requires us to overcome that stigma of talking about the fact that you may have a problem that needs somebody else's help, and you can't do it all by yourself. When we learn how to fly an airplane, or run ATC, or fly an unmanned aircraft, we go ahead and become an expert in different areas. Psychology is not necessarily one of those areas, right? And mental health is not necessarily one of those areas. And so reaching out to those who may have experienced similar issues and have had a way forward that worked for them, at least as a stepping stone. This idea of the list is great, that we have something like that that's available, because when you move to a new area, that often is the problem, right? Mm-hmm. You get into a new area and you're looking for an AME. If you just go down the list and go, well, I mean, it's a crapshoot, right? You don't know if you get, like as we mentioned, we don't know if we're getting the good one or if we're getting the not so good one, right? I mean, there are different levels of every profession out there. And so by having a list or some other method, but again, that social network of talking to our fellow pilots and finding out what worked for them is really a great way to go ahead and go about that if you don't have the list.
Speaking of the list, so what I would do if I was someone that was seeking therapy is I would take that name on the list and I would go to psychologytoday.com. A lot of therapists are on that, not every therapist, but what I really like about this site as well is you see the person's picture. Some people have a video, you read a little bit about them, and you see what they specialize in, right? So if what you're seeking therapy for, even though I do specialize with the aviation population, is not one of my specialties, right? Then you can try somebody else. And maybe again, you don't want a therapist that, specializes in the aviation industry. You can again put in your symptoms that you're having, and it will pull up a telehealth in person. It will tell you all that. And also a lot of therapists will offer a free 15-minute consultation. So you can at least either call or do some sort of video conference, and you can get to know them a little bit, ask your questions before you commit to actually going to therapy with them.
Sort of last but not least, the official FAA.gov has a list of the HIMSS psychologists and HIMSS AMEs that you can at least give a call to, and maybe they have suggestions if you need something specific in your area. Oh, hold on. Okay.
Is it ready?
Try it again.
Is it?
There we go. Good.
Okay. Can this be applied to psychiatrists as well?
The searching?
Yes.
Yeah, so I think all of those suggestions are pretty good. I know there's him psychiatrists for medication, there's him psychologists and neuropsychologists for assessment and therapy and that sort of stuff. And I believe psychiatrists are on Psychology Today too, aren't they?
I'm not sure.
So we don't have enough psychiatrists in this country, period.
That's fair.
So it's very, very challenging. I will tell you kind of a common pitfall. A lot of states have psychiatric nurse practitioners, right? But from the FAA level, right, they have to be MDs, so just be careful of that. Most nurse practitioners are supervised by an MD, so you may have to enter the system that way and kind of work up. There are some psychiatrists on Psychology Today. It's mostly psychologists and master's level therapists, but it's starting with your health insurance benefits. And again, Google search can do wonders. But be very careful. There are a lot of websites that farm our information as providers off the National MPI directory and might create fake reviews or fake kind of profiles. So try to actually find the website of where that person works and look at where they went to school, right? Look at all these other factors.
I had something, let me think. I'm not a pilot, so it's okay. So I think a good resource that college students have that's unique to most college students is you have a counseling center on campus. And what's great about a counseling center is it often has a case manager who has those contacts within the community. So that's a great resource to use. And I don't think a psychiatrist necessarily has to be aviation specific as long as they know the meds that you cannot take and that it needs to be monotherapy. And that's something that you can advocate for too for yourself because the AME guide is available to the public.
Yeah.
Yep. Oh, hold on. Okay.
So talking about seeking help in a more professional manner, we had two questions that kind of got at the same thing, so I'm going to merge them together. When you go seek formal treatment, as a provider, what is the line that you talk to maybe a patient about grounding? What kind of, how do you deal with that fear with them? How does that kind of come up in conversation? We have two questions. One asked, what types of language should be used / any words that should be avoided in therapy? And the other one asked, how do you help with the fear of grounding during training? Simple question. No.
No gray area at all. So something that I do with my folks who come see me is I have a really upfront conversation about confidentiality, what documentation looks like, and what reporting looks like, basically. How I decide to diagnose is there distress and is there true impairment? Are you safe to fly? If there's a diagnosis, then it's up to the pilot to make the important decision to share that. Confidentiality is something that psychologists hold to the utmost importance. You have to really try to make us break confidentiality. But it's up to you, and we sort of walk you through that. A good therapist, a good psychologist will be able to explain that to you, and you guys can collaboratively make the decision to go forward with mental health care or try to figure something else out. I think the biggest thing for me, like I said, when talking about self-grounding is how are you coping in life in general, and how are you coping when you're flying? Let's take, for example, a phobia. Let's have you have a phobia of needles. Are there needles on a plane? No. You're probably safe to fly. We had this discussion earlier today, so I got confirmation that this is okay. But for example, right, this disorder of phobia isn't something that is going to be impactful or impairing to my flight. Is major depressive disorder impactful to flight? Sort of depends on what level you're at. And you, your psychologist, your psychiatrist, your AME, get to have that conversation and be upfront with each other about how we're going to go about doing this. Are you safe is the main issue. I don't want to talk about any words to avoid.
Yeah, don't avoid any words
Yeah.
of therapy. Let it out. I mean, we've heard it all.
We can't say anything.
No, yeah, we are not mandated reporters to the FAA, right? So you talk about that confidentiality, that's legal. When you enter therapy, we have what's called either a informed consent or a professional disclosure. Language may vary state to state, but you will have a document that you will read inside sign that talks about this. And then I go one step further within aviation or any of the safety sensitive professions that I work with to, kind of cover those bases too. In terms of grounding, at the end of the day, your decision, your insight, you have to decide that. You have to know where your line is. That's something, I don't have a checklist. I always joke with pilots, I don't have a checklist on my desk for that. And I don't have like a super secret button under my counter like at the banks to the FAA. It's not how this works. So don't hold back on any of the words in therapy, because if you're avoiding words, they're probably the ones that need to be said. But at the end of the day, it's helping you make that best decision for you. In the 12 years I've been doing this, I have only had that grounding conversation twice. One pilot entered my office incredibly impaired from alcohol. The other pilot had already had an event on the flight deck. So they already knew the answer before they walked in and asked the question, because they'd already had an event on the flight deck before they came to me. So it is very, very rare.
I am not a clinical psychologist. I'm a research psychologist. So I'm not going to talk about what happens in my practice because I don't have one. But what I would encourage people to not do is don't self-diagnose. I have heard issues of people going into a non-aviation trained or familiar psychiatrist, psychologist, and saying, I have depression, I have anxiety. And they put that down and use that as a diagnosis. And then it's in the records. And now you have that moral quandary of, am I reporting this to the FAA or not? Hopefully you're doing the right thing, right? But is it because you actually have a diagnosis of depression? Did they go through all of the things to diagnose you into that, or did they just take your self-disclosure as being that? So give them your symptoms. Let them evaluate whether or not you have a condition or not, or whether you're just feeling sad, feeling depressed, but don't have that larger condition that's there. And then that lets the system actually work. So I would encourage you to, again, just focus on the symptoms that you're having and describe those. Don't hold that back, but don't come in with a diagnosis already. Correct me if I'm wrong there.
That's where I got it.
Exactly. Yeah. Just being mindful too that just because I'm having anxious symptoms does not mean I could be diagnosed. Maybe, but it's not always the case, right? We have to use our DSMs, and there's very specific criteria for every single diagnosis. So keeping that in mind too. And then I was also going to suggest, if you do have your intake appointment, which is your initial appointment, bring up any questions, concerns. Bring this paperwork if the therapist doesn't specialize in aviation. Bring the decision tools and this is what I'm working with, because then okay, this the FAA said these are the conditions that are acceptable, and you can present that paperwork to your therapist. But the intake again is your time to ask questions, give any comments, concerns, and things like that. And there's no diagnosis at that point, right? So again, if you're like, hey, this is not for me, okay, case closed. There's no diagnosis. So I would suggest that too.
Oh, yeah. Go for it.
Okay, I have a question. Can you hear me? Yes. Okay. So I know the confidentiality piece is huge, and I also know that the first time folks often hear about confidentiality is when they are in a session for the first time. And so if we're thinking about getting to students prior to that, right? Do you recommend colleges and universities talking about the confidentiality piece to encourage students to see you all?
Something that I like to do in our college at UND is go visit classrooms. And I do walk through what confidentiality looks like. Generally, there's 3 exceptions to something being confidential if you're an imminent risk to yourself or someone else, as in suicide or homicide. If there is a abuse or neglect of a child, elderly person, or disabled person, or if I'm court ordered. Everything else I cannot talk about. If you come into my office, I can't even say that you were there. I can neither confirm nor deny. So I go through that with a lot of my college students in the classrooms. I try to make that as obvious as possible and share that information. So there's only so much we can do, but yes. Great question. Any other questions right now?
About peer support confidentiality too.
Oh,
Yeah, I have a question.
yeah.
So, I manage instructors, and then usually students come to instructor first and then talk about it, but they are not psychologists, they're not doctors. Do you have any advice for us to give them, like if a student come to it, start talking, is there any like things that we should look at or watch out,
Again, so the question was, if a student comes to a professor and starts talking about some of this harder stuff, is there any advice for the faculty or professor or staff?
It's more like flight instructors.
Flight instructors, okay. Well, CFIs, huh? So, if you're about to go up in a plane with someone, safety is what you need to think about, right? And our faculty and staff are able to go through a green bandana training and get training on how to assess for suicide risk. So that's something that our people have some awareness of. The worst thing you can do if you are concerned about suicide is not asking. There's a lot of research out there that shows that asking, have you been having these thoughts? It's not going to make them do it, right? It's not going to make it worse. If anything, it will stay the same or get better just by asking. So if you're concerned, for sure, ask. And then have those resources available too. So, it sounds like you're having a hard time with the death of your friend. Have you been able to talk to anyone else about this? How are you doing? Right? Asking those open-ended questions like we teach our peer supporters, and having that conversation. Listening can do a lot.
Just general comment on that, and I think you said it too, the wellness, and getting there before it gets to be a big problem. I'm the one who teaches the high school kids here, we got 24 of them, so they're high school kids with high school problems. You know what I'm saying, just because you got dumped for the dance.
No sense of scale there.
That's terrible to them, but you're like, okay, it's gonna be okay. What you said with CFI and then talking, because you have conversation when things come up in the airplane sometimes. We do this thing monthly called Human Factors Councils, and it might be something that the military does. That's where I took it from. So HFs.
Turn it off.
Can you talk louder with the Marine in me?
You're good.
Well, I was a Marine safety officer in my squad.
You should be good now.
I'm good now?
There you go.
Yeah. So I took that director of safety at our high school. So this stuff is obviously important. We had a young, one of our students whose father passed away while we were flight training. One came to me and talked about my parents are getting divorced. Just to make me aware of that, we try to break that stigma of, hey, you can talk to us. It's going to stay with me. I have no way licensed for anything that we have here. But we want you to finish this program and be strong, get through it. So building that trust with them. But like I said, monthly we do a Human Factors Council. We talk about every student that we have. How are they doing in class? Are they overstressing themselves or whatever? Because you sense these things. It's a small group. We have a small group as instructors too, so we have the luxury of doing that. And that's helped a lot to identify these things. And then I make it a point to talk to these kids often, just in case, hey, how's things going? How's classes going? Hey, how's things going with the divorce with their family there? Just to, just talking sometimes is good enough to care. If it's beyond my level, we have our counselors that would take them to. Rarely have we had to, hey, we're just gonna stay off the flight schedule. But we tell them it's okay. It's certainly okay. I mean, I was a perfect example of that. I had a tragedy in my family and I was off the flight schedule. just to know that, hey, it happens to everybody. We're all gonna be there. So I don't know if that kind of helps with that, but you just have to talk about it. And breaking that stigma for them, for these high school kids, it's a big deal.
I just have one thing to add. If you have someone who you believe is in crisis, there's a couple different places you can go. So the emergency department. So there's a couple places you can go if you think someone is in direct crisis, right? You were saying, you know, you can ask, do they have an intent? Do they have a plan? If they do have a plan, what is their plan? And then, you know, if they say, hey, I've got a gun, you know, do you have access to guns at home? You can kind of ask those questions. I do that regularly in the emergency department because people come to the emergency department in crisis, right? That's what I'm dealing with, people who are homicidal, people who are suicidal, things like that. So an emergency department is always a safe place to go if you don't know what to do, okay? In the emergency department, we have a lot of resources depending upon where you are. Sometimes we have trained psychologists, sometimes we have trained psychiatrists, sometimes you're in podunk, nowhere, but we actually have people who will come in for crisis situations from like a community mental health. Community mental health is someplace you can contact as well in each city. So Kalamazoo, Detroit, you know, Hancock up in the UP, things like that. Community mental health is one. And then the VA crisis line is another one. And the number for the VA crisis line is 988. And then you hit the number 1. And that, even though you're not a veteran, that is something that they will help you for any crisis and kind of get you to the correct track where you need to be in. So if you think it's in an imminent danger and you're not quite sure what to do, those are 3 different resources that you can try. Community mental health also has an emergency number in just about every location to contact as well.
Real quick too is, like for here at Western, we have what's called our mental health first aid training. And that's something our faculty takes, and we offer it, throughout the year we'll offer it at different times. And I know it's something that we've talked about with our CFIs as well. So each institution or school probably has something similar or community, and definitely recommend it because they'll tell you, you're not someone that's gonna diagnose it, but doesn't mean you can't listen, right? And that's first steps.
Yeah, so I'm Chris, I'm a pilot over at United Airlines. And one thing that we actually do as part of our mandatory pre-flight briefing is talk about the rest of the flight. So we're actually going on weather, aircraft, things like that. But another thought that we have is just our own personal well-being of how we're actually feeling, that you can actually incorporate as a flight instructor as well. It might be as simple as, man, my commute today didn't really go well. I'm kind of having to catch up. It might be, man, my daughter just failed a test. I have to deal with that. It might be my dog threw up right, you know, my shoe right before I left. We kind of say a lot of things tongue-in-cheek as pilots, but every now and again it does kind of come up just that, you know, I have some stuff at home. Don't necessarily need to talk about it, but just want to let you know I have some stuff at home and I might be a little bit more quiet in this trip. And it's that easy. It's nice and easy to do that as a CFI and just model that behavior of, hey, you know, you're my fourth student today, it's 98 degrees, and I am sweating through my fourth shirt. And just a nice little quick tidbit, and they might be like, yep, like, I tried to get hydrated today, but I'm kind of feeling it too. Or, you know, it just opens up that conversation. And it doesn't have to be anywhere near the crisis levels that we kind of talked about as well. It's just a nice, easy conversation of where's your headspace for that day. And that's actually a mandated part of our SOP at United. So if you want to come and fly the friendly skies, you might as well start now.
Nice plug.
Awesome.
Yeah, like the gentleman was just talking about over there with United, something that we incorporated informally in a unit that I was with. We had a accident that had resulted in 6 of the members of the organization perishing in an accident. And one day when I went to the flight line, one of the pilots I was flying with said, hey, just so you know, I may be a little off today. My wife just got diagnosed with cancer. And we were away from home. And so we started informally adding that type of a question onto the end of our pre-flight, where we would sit down with the other pilots, and as we're going through what we're doing for the day, and the crew chiefs, the guys that are in the back of the aircraft as well, and go, is there anything that's distracting you from being able to be focused on today's mission? And that way we could understand if there was something there. And then make a determination as to whether as a crew we felt that it was still safe to conduct the operation, or whether we needed to go ahead and either find a replacement crew or find a replacement individual for that day. But it was a non-judgmental and not a grounding type of a discussion. It was a, hey, are you fit to fly? But using it as, instead of it just being an internal, am I fit to fly? Hey, let's go ahead and ask the question, and let's, as the pilot in command, be willing to be the example and sharing the different things that may be there. You know, I haven't eaten enough today. By the way, I woke up early this morning and I didn't get as much rest as I would have liked to, but I still feel fit to fly for the day today. But just understand, I want to make sure that it's there. And when we start opening up the book there and start taking away that stigma that every single one of us is that Superman that we want to be, then we can go ahead and encourage people to continue to open up and understand the different limitations that we have as human beings. Please.
And as an instructor too, I mean, your students, you have the same student for, but you get to know them, right? You can see, oh, they're kind of disheveled today, or they're really quiet and they're usually really talkative, or I can just see it in their face. So just like using those leading questions, like, hey, how's everything going with your classes? How's everything with your family, your boyfriend, girlfriend, whatever the case is, right? And then they might open up to you and, oh man, I got this thing going on at home and it's really stressing me out. And maybe it's something you have experienced too. So you can be like, oh yeah, I experienced that as well. And just having like that common bond, and just sometimes saying the things out loud and someone kind of validating what you're feeling is really helpful and therapeutic as well.
Yeah, there's a study that said like half the benefit you get in therapy is just showing up, right, and talking to somebody. And this is, you know, kind of a plug for developing peer support programs. My opinion, we need them for aviation students, we need them for CFIs, we need them for ATC students. Because when you talk to a peer, you know, connecting with just another human being, there's half of your mental health right there. We tend to be very isolated, right? The last few years have done us no favors. Technology does us no favors in this, right? That isolation can really amplify what you're experiencing, I think. So just kind of a plug for, if you don't have one already in your college, advocate for developing these peer support programs, because peers are typically trained in tenets of psychological first aid, suicide, assessment intervention, but also the same kind of privacy and confidentiality. So, back.
We have a Slido question that reads, to those who are interested in military aviation, or maybe who are on the flip side coming from military to maybe a collegiate university, or maybe 121, what records will be pulled during their initial in-processing and medical screening on both sides?
I think Dr. Dan's expect their stuff.
Oh, that's rough. So you guys have to deal a lot with the disability with the VA. So it's a whole process. You are supposed to make those coincide. There needs to be
One of them in the back answer.
Dr. Pavel,
Yeah.
you want to talk?
Can we punt this question to the back?
That's a good question.
It's an excellent question for somebody else.
Okay. Can you hear me?
Yes.
All right. So I'll answer both ways. I'll start with the going from civilian to military. So if you are going to be entering the military, you do have to provide your records as requested by MEPS, the Military Entrance Processing System. So that may include your mental health records as well. They do a full check to make sure that you are meeting the standards of accession, so being able to join the military. So be prepared to produce those records as they are required. So coming from military to FAA, to the civilian side of things. So as part of your medical certification process, you do have to mark on the 8500 form all the things that are valid, to include if you have, received treatment, if you've been hospitalized, if you're receiving military disability, if you are or have, if you've been entered into an education or an alcohol education program in the military, even for administrative purposes. So for those of you who are Navy, I see someone wearing a Navy shirt. If there was a captain's mast or something to that effect, or if there was an Article 15 that you received that was due to an alcohol-related incident, those records do need to be produced to the FAA to be reviewed. So they're not necessarily disqualified. So we review the records, we make a decision based upon that. Sometimes it is, sometimes it's not. So I'll be honest there. So we do a thorough review of the records. Military medical records don't always have to be produced, but when we ask for them, you do have to produce them. Your VA decision letter does have to be produced. So we can at least check through that to make sure, hey, what's going on, are any of these potentially disqualifying conditions? And then if we need further information, we will request it. Dr. Givanet?
Yeah, in the business of myth busting here, there's a common misconception about the VA project that's out there regarding disability, that the FAA went out and got a bunch of people's VA records. That did not happen, okay? If we get VA medical records, it's because we've asked you to go get them, because the documents that Dr. Pavel just talked about suggest that there might be a deeper problem. So no, nobody's going out there and violating the privacy of your VA records. What happened was the IG, Inspector General of the VA, and the Inspector General at Department of Transportation somehow got together and made a handshake about bouncing the two records off of each other to see if there were any disconnects.
Did get them.
And so that's all it was a screening process, and then they took 4,790 names and dumped them in our lap at the FAA and said, we have evidence there may be a disconnect between what's been reported at VA and what's been reported at FAA. You guys take a look at the safety issue. And so that's in essence what we've been doing over the past, 2 years now. I think that project has been rolling along, is to look and see, is there a safety issue here? Because quite frankly, we all understand that the VA disability rating system bears very little resemblance to true disability. So the fact that you may have a disability rating for something, that does not mean that we're going to have a problem with that in terms of your medical certification. So I hope that clears it up.
Awesome. Awesome, thank you. So we have like one more question, but I think this one might be interesting too. Is what research gaps still exist in understanding pilot mental health and how can they be addressed? This is a perfect audience for doing research as it's college. So if anyone wants a dissertation or a thesis, here you go.
I'm not going to get into what gaps are there because we don't have the time, right? There are a lot of gaps. I would just encourage you, if you have the opportunity to participate in research, please do it. Don't let decisions be made and data to be analyzed without your voice in it. So if you have the opportunity to participate in research, if it's an undergrad project, whatever it is, please participate because we need the data.
One of the biggest barrier that our research found for seeking mental health care were concerns of organizational stigma. And so getting further into that and trying to find ways that would help pilots and aviation personnel, air traffic controllers, UAS operators, be able to feel more trusting of the FAA and other regulatory bodies, that would be a good area for future research. What are the actions that could be taken by the FAA or DoD or other organizations that would allow them to feel safer with divulging the information that they are withholding or getting the treatment that they think that they may need. And that helps us overcome that most significant barrier that we found, which was, I am concerned that if I declare that I have any type of a mental health question, it is going to negatively affect my ability to work in the future in aviation. And I'm concerned that even having any type of mental health question in my medical records will keep me from being able to fulfill my career. The second one is, how do we overcome the negative aspects of self-reliant attitudes in aviation? Something that makes us great in aviation is that we are strongly self-reliant, right? If you're a pilot in an aircraft and it's just you or you and one other person, you have to be self-reliant. If you're manning a screen in an air traffic control facility, or you're up in the tower at the air traffic control facility, you have to be self-reliant. But at the same time, we have to understand that just like when we have a broken leg, we're not so self-reliant that we don't go to the doctor. If we start to have a problem, we need to be able to overcome that strong self-reliance, because the number 3 barrier that we found was, I want to fix it myself. I fix everything else myself. I want to fix this myself. I don't want to talk to somebody else about it. So those would be the 2 big areas that I would look at. How do we overcome the fear of organizational stigma? And how do we overcome the negative aspects of self-reliant attitudes that we don't want to eliminate, but we just need to overcome those negative aspects?
And when it comes to research and data, if the numbers aren't right, you're not being served, right? If you're in the audience and you're like, yes, I have experienced this or that, but you're fearful to say that in a survey, even if it's anonymous because you're afraid you're going to lose your medical, then the data isn't correct, right? So it was brought up earlier on another panel. There needs to be a period of amnesty, if you will, where, okay, I'm going to say I have experienced these symptoms, but it's not going to be used against me down the line.
And that will really help us with understanding the level of mental health distress that people are able to cope with and still be safe aviators and still be safe aviation personnel. As we move towards that tract of not using a diagnosis as being the end all, but looking at the symptoms and their effects on their ability to undertake those flight and flight-related activities.
Yeah.
Sorry, we've talked a lot about how we respond to stress. I think one thing really to highlight too is how are we preventing stress or being resilient or hardiness with stress. So I just encourage everybody, we've spoke a lot about it today, is to look at stress resistance models. So I know the Kabasa stress resistance model, if you're familiar with it, is how do you have great nutrition, fitness, mental, physical, spiritual fitness. Take a look at that as well. I think it's really important to talk about is how do we as a group, what are your support networks? How do you prevent stress? How do you relieve stress so it doesn't become an issue as well? So that's something really to consider as well as we go through it. So.
I have one last thing really I was going to say my interest would be what symptoms of mental disorders actually cause impairment in the cockpit. So we all know sleep and concentration and fatigue are very impactful, but what about appetite? Like, is that something that in the criteria meets, can give you a diagnosis of depression if you have a bunch of other things, but is that something impactful in the cockpit? That's my interest, if anyone wants to take that up.
I was just gonna add on something about, after Jason was talking, ways, so there's a skill in a certain psychological treatment model that talks about working on happy too. We often think that happiness just kind of comes, but we have to actually go out and seek things that will add to our, so if we look at like wellness on a scale, we have all of the things that suck, right, about life on this side, and then all the things that are great about life on this side. And so making sure that we are being aware of how we're tipping our scales and how much good that we put into our own lives in order to outweigh or offset the struggles that we're going to face. And so I think that ties into when we look at aviation as our whole personality. We really have to be cognizant of what that does to tip the scale when something could go wrong. I had a question, I don't know if we have time, but we could think about it maybe. What types of recommendations do you have for how faculty and staff can support student stress levels in terms of like cognitive empathy, ways that they structure their classes, to make sure that they are tailoring to supporting students and setting them up for success?
That is a great question. And I think the peer support panel might be a really good one to answer some of that too, because they're part of the college population.
Yeah.
I can answer
yeah.
something real quick.
In addition to peer support, I live in Michigan, obviously, like I just said, but if faculty ever wants somebody to come in like myself just to speak, just kind of like how we did today, and advocate that way, I think that's a good idea to have somebody, again, like ourselves, just come in, do a presentation, get the word out there, and then kind of work further with that.
Yeah, you'll find a lot of mental health professionals, not just, we love to talk, but we are trained in things like psychoeducation, advocacy. It's not just therapy. We are trained to do kind of this kind of all wheel of services. So finding someone maybe for a specific topic, finding an expert in that topic, I don't know a single mental health professional that would say no to coming and speaking and supporting people.
And I think we're pretty much out of time, but I think the biggest thing you can do is be a human being with your people, right?